Vaccine-preventable diseases are making a comeback. Rodney Throgmorton never thought one of the most dangerous and contagious of those diseases would break his family's heart.
I'd always felt like I'd led a charmed life, and I had delivered a baby. I had played in the state championship game. And I always thought that bad things happen to other people. But when I was faced with the death of my daughter, I realized that bad things happen to everybody.
In 2003, Rodney and his wife, Jerry Lynn, celebrated the birth of their daughter, Haley.
She decided to come into the world 12 days early, and we didn't even make it out of the house. I got to deliver her, and that was the greatest thing I'll ever accomplish.
But that joy was short-lived. When Rodney came down with a cough he caught from his mother, he had no way of knowing it would result in Haley's death.
When Haley first started coughing, I knew that it wasn't just a normal cough.
After extensive testing, Haley was diagnosed with pertussis, or whooping cough, a disease that largely disappeared after a childhood vaccine was introduced in the 1950s.
When she was first confirmed to have pertussis, we were kind of in disbelief. I know that I passed pertussis on to my daughter, and I know I got it from my mom. We have no idea where my mom might have got the disease, but it had to have been from someone who wasn't vaccinated and someone who had the disease.
When she was just 6 weeks old, Haley lost her brief battle with whooping cough. Haley never had a chance to receive a dose of DTaP, the diphtheria, tetanus, and pertussis combination vaccine that could have saved her life.
Haley passed away when she was right at a month and a half old, and she wouldn't have received her first round of DTaP until she was 2 months old.
There are children that may be too young to receive a dose of vaccine. When vaccines are licensed, they do have a lower age cutoff, and they may still be vulnerable to that disease. Transmission of pertussis from parent to child is a big issue.
If you immunize the adults and the caretakers and make sure the children in the household are all adequately immunized against pertussis, it's much less likely the child will get pertussis.
The Centers for Disease Control recommended in 2006 that all adults receive a Tdap shot, a whooping cough booster shot for adolescents and adults that can provide a shield of immunity for infants too young to receive their first DTaP shot. Unfortunately, the Tdap vaccine came too late to protect Haley.
Less than a year after my daughter contracts pertussis from me, it was a little frustrating when I found out that there was now a vaccine about to be available that would have protected me, and subsequently I would have protected her. If my parents and I had all been vaccinated, then she wouldn't have got that from us. The worst possible scenario would be your child getting a vaccine-preventable disease from you, or your grandchild getting a vaccine-preventable disease from you.
Adults and adolescents who are immunized provide newborns with a cocoon of safety against disease. It's a type of immunity protection known as herd immunity.
Herd immunity, community immunity, is the concept that you don't have to vaccinate 100% of the population to prevent the spread of disease.
So that if you have a herd that's well immunized, even if you bring in someone who is not immunized or who has the disease, the herd is by far more protected. And that includes not just your child, but it includes perhaps your aunt who's on chemotherapy, other people in the community, not just children who haven't been vaccinated, are at risk. And so herd immunity is a very important concept.
There are hundreds of thousands of people in the United States who cannot be vaccinated. They can't be vaccinated because they're getting chemotherapy for their cancer. They cannot be vaccinated because they're getting immune suppressive therapy for their transplants or their rheumatologic diseases. They depend on those around them to be vaccinated, because otherwise they're the ones who are most likely to suffer or be hospitalized and die. They depend on us to protect them. And I think it's our duty to protect them. And what's happened to herd immunity is it's breaking down.
And that breakdown in herd immunity is evidenced by the resurgence of whooping cough cases in the United States. In the 1940s, at the height of pertussis infections, there were 250,000 cases annually. When the first whooping cough vaccine was introduced, the number of cases plunged to just over 1,000 3 decades later. But in 2010, more than 21,000 people got whooping cough.
You can say comfortably that herd immunity is broken down, and now we're all at risk, at greater risk. And so a choice not to get a vaccine now is a more risky choice than it was arguably 10 years ago.
And pertussis cases have multiplied in Florida from the year 2000 to 2010. In 2000, there were 48 reported cases of whooping cough in Florida. In 2009, there were nearly 500 cases reported in Florida.
Pertussis is still a disease that's uncontrolled in the United States. It can be with vaccination, but we're not there yet.
Some diseases are so highly contagious, measles, mumps, whooping cough, chickenpox, that you need a very high percentage of the population to be vaccinated in order to prevent spread.
In Florida, our rate is in the low 90s in terms of overall vaccination. And that's really good under one lens. On another, we don't have to be perfectionists to realize that we want that higher.
We need to achieve those higher than 90-95% levels of coverage in order to prevent transmission.
Even when we look at overall vaccination rates, which may be quite good, we have to realize that that's an average across a state or across a country. And so there's still going to be pockets where it's much lower. And we've seen this with outbreaks of measles and pertussis and other diseases, Haemophilus influenza.
An outbreak in measles in several northeast Florida counties in the early 90s illustrates the danger. Close to 200 cases of measles were reported in 1991 and early 1992. 82% of the cases involved people who were unvaccinated. Of all the reported cases, 47% occurred among children younger than the routine age of vaccination. A dramatic breakdown in herd immunity.
What you're seeing then is an erosion in vaccine rates in certain communities in this country that has caused an outbreak in vaccine-preventable diseases, that has caused children to suffer and be hospitalized and die. It's unconscionable. It's not okay. And yet we let it happen. How many more children have to die before we say this is enough? Is that the only thing that's going to turn us around? That we just haven't had enough children die from these diseases?
While disease can spread within tight-knit communities or families, it can also come from across the state, sometimes from across the world. It is all part of the risk of living in a mobile society, a risk that has existed for hundreds of years.
The mobile society started, from our point of view, right, in the United States, when Columbus discovered America. And a whole series of infectious diseases that were in the old world, in Europe, were introduced to the new world, among them smallpox, with devastating effects on native populations. Interestingly, many infections in the New World also were introduced into the Old World. And so this idea of mobility, of connecting populations that were previously separated, has been around for hundreds of years. Almost all the epidemics, the small ones we've seen in the United States in the last couple of decades, have come because of returning visitors, returning tourists, people on a mission trip somewhere else, who come back to the U.S. And because there's an incubation period, meaning there's a time when you're infected before you show any symptoms, it's very easy to go back home, be infectious, contaminate other folks, and not know you're sick at all. Then you show the first signs of disease, and it's in some sense too late. You've already spread the condition to everyone else in your community.
In 2009 in South Florida, there was a deadly outbreak of the W135 form of meningitis, a strain covered by the meningitis vaccine. The outbreak left CDC officials baffled. While they had studied outbreaks of the disease in Africa and the Mideast, they had never seen a case like the one in Florida. 4 people dead and 8 others ill in one area, with no obvious connection between the patients.
Visitors to South Florida and Central Florida can bring with them diseases even when they don't know it. So they might get on a plane feeling perfectly fine, because we know when you get infected with something, there are several days, sometimes several weeks before you feel sick. And so they can come into our state and pass an infection along to the rest of us.
Measles is an example of a vaccine-preventable disease that continues to spread in our mobile society. The spread of measles was declared eliminated in the U.S. in 2000. But in 2008, there were more than 130 measles cases reported in 15 states. The CDC says close to 90% of those cases were either acquired abroad or linked to imported cases. More than 90% of those infected had not been vaccinated. In February of 2011, the CDC warned that tens of thousands of airline passengers may have been put at risk by a 27-year-old woman who tested positive for measles and traveled through airports in Washington, D.C., Denver, Colorado, and Albuquerque, New Mexico.
These viruses and bacteria do not need passports. They don't need green cards or visas or anything else. They can travel anywhere they can. And we live in a global society where people are constantly moving back and forth.
Janice Flood Nichols is a polio survivor who lost her twin brother to the disease. She says even though wild polio has been eradicated in the U.S., it remains a global threat.
In 2010, we had just under 1,000 new cases of polio. But public health officials now know that just the way that we move in society from area to area, country to country, continent to continent, if we don't eradicate polio soon, within the next few years, we'll lose our last best chance, and that by mid-century, more than 10 million children will be paralyzed by a disease that no child or young adult has to get.
I think we need to be mindful that these diseases are not all eradicated, that the childhood immunizations are very important for our children here, particularly in a place like Florida where we get new immigrants all the time, as well as families who travel elsewhere.
Florida Shots is an online immunization registry that helps the state and healthcare providers deal with the immunization challenges posed by a mobile society.
Florida in particular is a very mobile state. People are moving around a fair amount. And having a registry of vaccines, even within our state, is really an essential part of our public health system.
Along with Florida Shots, the Florida Vaccines for Children program helps keep herd immunity intact by providing vaccines free of charge to families who would not otherwise be able to afford them.
The thing about infection is it cuts across all lines of socioeconomic. It doesn't matter if you have a higher education or you're in whatever strata economically, but contagion is contagion.
Should it be your individual right to catch and transmit a potentially fatal infection? I don't think so. You would like to believe what compels us is that we see it as the wrong thing to do, that we have a responsibility for not only our children, but children who come in contact with our children, and that's what motivates us, so that we see us all as part of something common, that we're in it together.